If you struggle with hip bursitis or pain in your piriformis, then we need to strengthen these glutes here and round the back to stabilize that thigh and prevent it rolling or drifting in, which is going to add extra strain onto that hip bursitis site or in that piriformis. So here are some exercises that we're going to do, and I'm going to show you what mistakes that you need to be aware of when you're doing these exercises so that you get the full benefit. Come and lay on your side. Now, ideally, we want to rest your head on your hands so that your spine is nice and neutral. You're going to bend the bottom knee, and you're going to have a little bit of your knee in front and a little bit of your foot behind you. Extend your top leg. Now, we're going to keep the foot parallel, the whole leg parallel with the hip joint. We're not going to take the leg down because that will stretch and possibly irritate this site here of the pain in the hip bursitis. So always keep your leg hip height. Make sure your leg is in line with your torso. From here, take the leg up nice and slow and controlled and bring it back down to hip height. And you're going to repeat this exercise for anywhere between 8 and 15 times, depending on your level of ability. Once you've done a set here of these, keeping your pelvic floor and tummy drawn in and your pelvis neutral, that means your pelvis isn't going to rotate or move. Draw your leg back so that it's over your foot, which means your leg slightly behind you. Again, keep it hip height. Lift and lower the leg here for, again, about 8 to 15 repetitions. Next, we're going to circle that leg. So we're going to start with the leg here in the center, hip height, no lower than this. Bring it forward until it's just above the knee. Then take it up a little bit higher than the hip and take it back towards your foot. We want that movement to be at your hip joint. We don't want the pelvis to move. So we don't want to be rotating the pelvis back to get that foot back, because that's movement from your lower back, not from your hip joint. So keep this pelvis nice and stable. And again, working for between 8 and 15 repetitions. And then you're going to repeat that on the other side. A couple of things to be mindful of when you're doing this exercise is that you're not hiking up and rotating your hip, and that we're moving with slow and controlled movements. A couple of other things you might want to be aware of during the day is that you're not sitting with your legs crossed, because again, that's going to strain that hip joint. Let's roll on to the other side and run through those exercises again, and I'll give you some more tips on how to get the most out of this exercise. Come and lay on your side. Rest your head on your hand. Again, a little bit of knee in front, a little bit of foot behind. Straighten out the top leg, making sure your leg doesn't go any lower than this point. Let's take the leg up, nice and slow. When you're doing these exercises, also think about pushing your heel away from you. That's going to help stabilize your pelvis and makes a little bit of space in the joint so that you really work those glutes. 8 to 15, depending on what your level is, and then take it back over the foot, making sure that your pelvis doesn't follow the movement. That's also going to give you a nice stretch in your hip flexors as well. Lifting and lowering over that foot for 8 to 15 repetitions, pushing the heel away from you. When you've done the number of repetitions that suit you, you're going to bring the leg forward, keeping it hip height, up, circle back over where that foot is, and then bringing it forward again. When you finish that exercise, just get up, have a little bit of a walk around, but don't stretch those muscles. It might feel like you're getting a little bit of immediate relief, but what it's actually going to do, it's going to cause more strain and irritation over that hip bursitis point. Any questions about those exercises, pop a comment below and I'll see you in another video.